Hi, my name is Dr. Michael Corey, and I'm Clinic Director here at Wellness Stop Natural Health Center in Tustin, California. I want to stop by and just welcome you to our thyroid webpage, and I want to pass on some information, give you a brief overview of how we approach your thyroid problems and how we can correct the underlying causes of why you're feeling the way you do. Now, very often we're going to see that thyroid sufferers are going to experience many symptoms, including hair loss, weight gain, fatigue, insomnia, irritable bowel symptoms, diarrhea, constipation, and those types of things, in addition to just overall fatigue and brain fog, where sometimes you get confusion and you're just not yourself anymore. Well, all chronic conditions, including thyroid disease, which gives you these thyroid symptoms that we just reviewed, in addition to IBS, type 2 diabetes, vertigo, chronic fatigue syndrome, rheumatoid arthritis, insomnia, PCOS, infertility issues, hormone issues in general, they're all caused by metabolic imbalances in addition to neurological compromise. So metabolic imbalances and neurological compromise, meaning how your brain's working and how you're processing fuel and activation. So some of those metabolic imbalances include things like anemia, unstable blood sugar, adrenal gland dysfunction, autoimmune attacks, food sensitivities, hypoxia, chronic inflammation, and toxicity. And most importantly, what we want to look at is that we're in a world of what we call a toxic soup. We have pesticides, we've got herbicides, we've got cosmetics that can cause imbalances within the hormone system. All of these are affected, and your thyroid regulates your metabolism and is important for every muscle, cell, and tissue of your entire body. So we want to always make sure that we get to the core cause of why you're having the problems. Metabolism is when you eat food, when you take in nutrients, and it produces energy. Very, very important. Well, very often, probably in 75 to 90% of my patients that come in with thyroid issues, we've got metabolic problems. We want to look at your metabolism, but we also want to look at how the brain and spinal cord and how the nerves are working. The nervous system controls your brain, spinal cord, and nerves to every muscle, cell, and tissue of your body. So if you have a metabolic problem, your brain will not work because your brain is the most metabolically active organ in your entire system. Once again, regulating how your hypothalamus to the pituitary to the thyroid axis with your adrenal glands and so forth work all together. But everything's got to come back together, and we've got to evaluate you in this way. So how does this happen? Chemical stress, we've got physical stress, we've got emotional stress, and these stresses, especially when they're bombarding you on a regular basis and sometimes for many, many years, that causes the brain to fatigue. We've got fewer nerve impulses reaching the brain and back down to the thyroid to function properly to the rest of your organs. Now, all cases of thyroid dysfunction falls into neurological problems and also metabolic problems. So we've got problems with the nerves, and we've got problems also metabolically with your fuel supply to the nerves, muscles, cells, and tissues. So we want to look at the cerebellum and how the nerves are firing and activating the brain, so it comes back down and we get proper stimulation through the feedback loops coming back down to the thyroid. We want to look at your blood sugar levels, oxygen problems, cortisol levels, because that indicates inflammation. We want to look at your midbrain. We want to look at also hormones. We have functional testing that we do in our office to evaluate you for all of these different areas. What we're going to do is we're going to bring these pieces back together for you. We want to make sure that we look at you as a whole person, not a person just looking at symptoms, trying to put a masking over the top of it so you don't feel the symptoms. We want to make sure that we help you get to the core corrected with the causes of why you're having the symptoms in the first place. So what I'd like you to do is I want you to evaluate yourself right now. On a scale from 1 through 10, how serious is the problem that you're experiencing with your thyroid? How often are you having the symptoms? Is it interfering with your lifestyle, your family? Is it interfering with the quality of your overall life? Due to time constraints, I do want only the most serious patients that are having consistent problems to call my office. I'm here to help you. We do have a process in our office that we can evaluate you. We can get to the core cause of the problem. And I'd like you to take a look at some of the testimonials that are on this page and on my testimonial page on the website so that you can see how we've helped others and given others the quality of life that they deserve. Now, what I'd like you to do is, if you are ready to tackle this and take control of your thyroid symptoms and your problems with your thyroid metabolism, I'd like you to complete the form to the right of the screen right here behind me. And with this, when you fill out the information, we won't share any of your information. It'll be confidential. We're going to provide you with a free video report. I've got a DVD here we can send you, or we can send you the link as well so you can watch it on your computer. And also request an evaluation. If you'd like to contact our office directly in the office, our telephone number is 714-730-5833. My name is Dr. Michael Corey. I'm here to help you get back your life and be able to be all that you can be. Thank you so much. And there's another video on this page. It's a 45-minute talk. I go into more detail. So if you'd like to watch that, then by all means, we're here for you. We want to help you out. Thank you. Have a wonderful day.